Well, now we are going to see about the skin turgor assessment test, which can be done for all the patients in critical care areas, emergency areas, as well as for as a routine screening in the initial nursing assessment as well. So in this session, we'll be covering about what is skin turgor, what are the assessment you will undergo for a patient to do the skin turgor test, and what are the sites of skin turgor test as well as the findings of the skin turgor test. So this skin turgor test is nothing but the skin elasticity test, which is done for all the patients to identify to know the level of dehydration. So this skin turgor test is measured by using two fingers of the examiner, that is the index finger and the thumb finger, over the antecubital fossa or on the dorsum of the hand. So in this picture it is done on the dorsum of the hand, and you will be checking for the return perfusion as well as the return of the elasticity of the skin. Usually the turgor is considered to be normal if the time for the skin to return to the hand was less than 2 seconds, and is considered decreased if it is more than 2 seconds. So in case of an elderly, just keep in mind already their skin is totally wrinkled. So for those clients alone, we will be checking on the forehead, collarbone or sternum. What can be the possible causes for poor skin turgor? Yes, in case of decreased fluid intake, severe dehydration, any fluid loss might be due to diarrhea. In diabetes, they'll be having polyuria. That's the reason where the fluid can be lost. Extreme weight loss, like for a patient who is on a weight loss therapy, for these cases, suddenly if they have gone for example, from 100 kg, suddenly within 3 months they have reduced to 45 kg. So those cases also can have poor skin turgor. Severe heat exhaustion, clients who are exposed to extreme temperatures, like who are working in the eastern countries, vomiting, and any sort of connective tissue disorders such as scleroderma or Danlos syndrome, the elasticity of the skin is totally lost. So, what will be the possible signs and symptoms for these cases? These cases are going to have dry and sticky mouth, lethargy, sunken eyes, weight loss, decreased urine output or no urine output, that is oliguria or anuria, dark yellow urine due to high concentration of the urine, poor skin turgor, delayed capillary refilling, dizziness, confusion, lack of tears, sweating, high risk for fall, low blood pressure, rapid heart rate, and abnormal lab values. All these which is indicating the signs of dehydration. Skin turgor with fluid loss comparison. So, in case a turgor time is around 1.5 seconds or less, which indicates that the infant or the normal child can have 50 ml per kg body weight loss, or the water being deficient from the body. And in case if the return of the skin is taking for more than 3 seconds, then around approximately 100 ml per kg is being lost from the child's body. And if it is more than 3 seconds, which indicates that there is more than 100 ml per kg of fluid loss from the body. How do we do the skin turgor test? The skin turgor test is as sequence: perform hand hygiene, greet the patient, identify the patient, then you explain the procedure. You're going to choose the right site. As I told you in elderly, you have to go in for forehead, collarbone, sternum in the elderly. And we do the pinch test, such as pinching the dorsum of the hand. So you are going to do it for at least 3 to 5 seconds, and see the dented upwards, and then slowly you are going to release it. So immediately once you release, observe for the skin return with a stop clock, whether it is going to go for more than 3 seconds or more less than 2 seconds. In a normal adult, it is always less than 2 seconds. And finally, you can record the documentation in the documentation nurses record. To summarize skin turgor test, it is otherwise called as dehydration assessment. So this is a quick tool, an effective tool which assesses the hydration of the status, especially in case of all the pediatric and geriatric population. And complementary indicators such as it is also for giving us a sign of dehydration, dry mucous membrane, decreased urine output, and altered mental status. To conclude, skin turgor test is a valuable clinical assessment tool for evaluating hydration status, particularly in settings where rapid assessment is very necessary, such as in ER or ICU. However, we have to consider along with other clinical findings of the patient condition. So these are the assessment tests used for skin turgor, and these are the references which I have gone through for the skin turgor assessment. Hope you all enjoy the video, and possibly as a nurse we should know for elderly what are the sites we assess, and for a normal adult what are the possible sites we assess for a skin turgor test. Thank you.